along with Ankit Pandev, AJ Oliver, and Morgan Bailey. We are Cedarville University SNPhA. Cedarville is located just south of Springfield, Ohio, which for the last 3 years was listed as the unhealthiest city in the state of Ohio. Our Prescription for Service project aims to combat the issues Springfield and other cities face in their lack of health care. A few stats about Springfield are that they have a premature death rate of almost 475 people per 100,000. This is compared to the national average of just over 330 people per 100,000. Springfield has a 31% obesity rate and a 20% smoking rate. Over 11% of people under the age of 65 have no health insurance in Springfield. A few barriers that people in Springfield face when trying to obtain health insurance is that there's nearly a 30% poverty rate, and there's also a lack of education about what people are entitled to under the Affordable Care Act. Our team has been thinking of ways to overcome these barriers, and now Katie is going to talk about the solutions that we can implement if we have access to this grant.
So we think that pharmacy is a great way for patients to get better access to health insurance. So for instance, patients can't normally just go straight into a doctor's office if they don't have insurance or an appointment. And if they go to an emergency room, they still might have limited care due to their lack of insurance. Whereas with a pharmacy, they are able to just come straight up to the counter and have a conversation with a real person that can give them a lot of answers to their questions related to healthcare. 30% of kids in Springfield under the age of 18 get their coverage through Medicaid. Unfortunately, a common problem in Springfield is that the parents are not educated on how to renew Medicaid coverage, and so what happens commonly is parents show up to the pharmacy with a prescription for their child and they're unable to afford the cost of the prescription due to the fact that their Medicaid coverage has expired and they didn't know how to renew it. So what usually happens at this point is the pharmacy staff doesn't normally know where to refer these patients to in order to get this medication paid for. So what our plan is to provide education to the pharmacy staff in the format of a computer module that would teach them where to refer these patients to, what kind of income limits to send each person. You know, if someone is unemployed, they might need to help their child get access through CHIP, whereas if someone has a job, they would be directed to the Affordable Care Act website. And so you can obtain a lot of these services online, but unfortunately very few patients are aware of how to actually navigate these websites. So in addition to helping the pharmacy staff direct those people to get the appropriate coverage, we would also train the pharmacy staff to help them navigate the websites, and then we would provide a computer in the lobby of the pharmacy where patients could actually sign up for health insurance coverage, and they could ask questions to the pharmacy staff that would help them navigate those websites. Because another common problem with the high unemployment rate and the high poverty rate is a lack of disposable income. A lot of people don't have internet access, so then they still can't access those services without an actual computer and internet available. So we would come at this problem from two different sides, both education and providing the tools needed in order to get the services that these patients really need and deserve. So we would, through this, hopefully we would see improvements in the rate of obesity and diabetes via better healthcare access for the patients in Springfield. So we really appreciate you listening to our presentation, and we're looking forward to this opportunity to help improve access to care in our local community. Thank you.